Success with Diabetes, Session 4. Know your numbers and stay physically active. One of the themes we want to emphasize in this course is control. But what does that mean? Control means that you are able to avoid ups and downs outside of your blood sugar target levels. By doing so, you can prevent complications. In order to control your diabetes, it's important to monitor your numbers. Self-monitoring involves measuring and ideally recording your numbers so you can see a pattern easily. Self-monitoring your numbers gives you and your provider valuable information such as how your body, and more specifically, how blood glucose, reacts to medications, physical activities, and food. In order to self-monitor how well you're doing, it's important to know your goals or target ranges. Keep track of blood glucose and A1C levels in a log. Have proper tools, like a glucose meter, and know how to use them. It may also be helpful to self-monitor blood pressure if you have hypertension or prehypertension, and the presence of ketones if you have poor glucose control. In today's session, we will also go over the importance of smoking cessation and physical activity. People with type 1 diabetes require insulin because their body doesn't make any. Constantly monitoring blood glucose is important to prevent large swings, hyper and hypoglycemia. We'll discuss what this means in a bit. For people with type 2 diabetes, it is important to monitor blood sugar because blood glucose testing is a great tool for self-feedback. It allows people to see fluctuations and daily changes based on lifestyle. This could be how different foods, sleep patterns, infection, or stressors can affect blood sugar levels. So blood glucose testing is a tool to help you make changes to improve your diabetes. You are worth it. Self-monitoring glucose also helps patients and providers to see how well a medication is working or not working. It gives clues to better medication management strategies. Let's go over some terms related to glucose monitoring. Fasting means you haven't consumed food in the last 8 hours. It's usually in the morning before you eat. Postprandial is checking your blood sugar 1 to 2 hours after you eat. What is my ideal range? This depends on a lot of factors. It is always best to consult with your primary care provider about the numbers right for you. In general, fasting should be 80 to 130 milligrams per deciliter. 2 hours after a meal should be less than 180 milligrams per deciliter. When should you check? In general, if you are on oral diabetes medications, it is usually advised to self-monitor fasting blood sugars. This is because some medications have a risk of decreasing your blood sugar too much. If you are taking insulin, you should check your fasting sugars and also check before administering insulin. If you are newly diagnosed with diabetes and trying to figure out a regimen that works for you, you may be advised to check fasting blood sugars and postprandial blood sugars. Ultimately, you want to plan with your provider to determine a glucose testing regimen for you. How to check your blood sugar. Make sure to always wash your hands before starting. This is important because residual food on your finger can give you a false reading. Dirty hands can increase your risk of infection. Have your lancet, test strips, and glucose meter at hand. Place the test strip into the glucose meter to turn it on. On your fingertip, choose where you would like to check your blood sugar. Don't check on the same finger every time. And pricking on the side of the fingertip will be less painful. Now use the lancet on the area you chose. If a drop of blood does not appear, massage your finger towards the fingertip. You can also try holding your hand beneath the level of your heart. Once a drop of blood appears, touch the droplet with the edge of the test strip and wait until the meter signals that there is enough blood to use. Your blood sugar will be displayed on the meter. If the reading is too high or too low, take the necessary steps that were instructed by your provider. Throw away the lancet in the sharps container. If you don't have a sharps container, contact your insurance company. The containers can be disposed of at some pharmacies, drugstores, and police station drop-off kiosks. You can check the following website to find a drop-off location near you: safeneedledisposal.org. Never throw your sharps into the trash because they can cause injury to others. Keep track of your blood sugar levels every day and log them so you can show it to your provider. If you use a continuous glucose monitor, check with your educator or manufacturer's instructions on usage. What is hyperglycemia? Hyperglycemia is when blood glucose is high, which is above 126 milligrams per deciliter. In people with type 1 diabetes, higher than 250 milligrams per deciliter is considered dangerous. People with type 2 diabetes can tolerate a blood glucose of 300 milligrams per deciliter without symptoms. When your blood sugar has been elevated for a long time, your body gets used to it. It won't be noticeable. But if a person has a blood glucose of 500 milligrams per deciliter, they must contact their provider or go to the ER immediately because there is a risk of developing serious life-threatening complications such as coma. Then why is it important to check your blood sugar? What are the symptoms of hyperglycemia? Excessive thirst, continuous hunger, frequent urination, tiredness, sleepiness, blurred vision, and nausea. So how can you avoid hyperglycemic episodes? Measure your glucose before eating. Eat multiple small meals. Eat fewer carbohydrates. Take your medications as directed by your provider, and stay physically active daily. What should you do to prepare for a diabetes-related emergency? Wear a diabetes identification bracelet. Keep a list of medications on the refrigerator. It may be helpful to carry a list that includes your medications, primary care provider, and health insurance plans. Hypoglycemia is low blood sugar below 70 milligrams per deciliter. Severe hypoglycemia can also be dangerous and possibly lead to coma. The symptoms of hypoglycemia are hunger, blurry or a change in vision, shaking, palpitations, sweating, dizziness, anxiety, or irritability. What should you do to prepare for a hypoglycemic episode? Educate your close family and friends and coworkers on what to do if you're having a hypoglycemic episode. You may become unconscious with severe hypoglycemia, so it's important for others to know what to do. Notify someone right away if your blood glucose is too low. Let's go over the 15-15-15 rule. If your blood sugar is below 70 milligrams per deciliter, eat something containing 15 grams of a fast-acting sugar, such as 4 ounces of any fruit juice or soda, 2 to 5 glucose or dextrose tablets, 5 to 7 sugar candies, 2 tablespoons of table sugar, or 1 to 2 tablespoons of honey. After 15 minutes, check your blood sugar again. If it's still below 70 milligrams per deciliter, then consume another 15 grams of sugar. Wait 15 minutes a second time. If it's still low, use the glucagon kit. Call 911 if your symptoms worsen. Do not wait for your family to come home. Do not drive yourself because your blood glucose is unstable. compromising your ability to safely operate machinery or drive. So check your blood sugar. If it's under 70, take 15 grams of fast-acting carbohydrates. Wait 15 minutes, then check your blood sugar again. If it's under 70 milligrams per deciliter, for the second time, eat 15 more. If it's still low, use a glucagon kit or call 911. It is important that you have access to a fast-acting sugar if you are at risk for lows. Foods that have fat and protein, like peanut butter crackers or candy bars, can actually make your sugar rise more slowly because of the influence of fat and protein slowing absorption. So what's a glucagon kit? Glucagon is a hormone released by the pancreas to increase blood sugar levels. Historically, glucagon kits usually contain a syringe with 1 milliliter of glucagon. Now, there are different forms of glucagon. Please ask your provider for glucagon if you have lows or if you are taking insulin. This is important, especially in cases where you've gone unconscious or if you're unable to consume something sweet. You can talk to your provider about whether you need a kit. If you do, your healthcare team will show you how to use it. Being sick can also cause hypo or hyperglycemia. It's important to have a plan for sick days. Check your blood glucose levels more frequently when you're sick. Talk to your provider about how often is appropriate for you during sick days. Continue to take your diabetes medications as directed. If you are unable to swallow or retain your medications, then consult your provider. You should always inform your provider if you change how you take your medications. Control your fever. Keep a kit with a thermometer and medication approved by your provider for controlling fevers. Avoid taking medications without a prescription. Talk to your provider or pharmacist before taking over-the-counter medications because they can contain added sugar or alcohol. And finally, stay hydrated. Let's go over the different tests that are often done in the provider's office with your diabetes team. These tests can tell your provider if you're beginning to have complications before you start to notice them. That way, you and your provider can come up with a plan to avoid diabetes complications before they even start. Why is it important to control blood pressure? Controlling blood pressure is important for preventing long-term complications for the heart and kidneys. High blood pressure is called hypertension. Hypertension is when blood pressure is above 140 over 90. If you have a blood pressure monitor, you may have noticed that there are numbers by SYS and DIA, sys over dia. The sys is the systolic blood pressure. This number represents the pressure in your arteries each time your heart beats. The dia is the diastolic blood pressure. This number represents the pressure in your arteries between heartbeats. So these numbers represent the highest and lowest pressures produced by your heart. Everyone should aim to have a blood pressure under 140 over 90 unless otherwise stated by your provider. The reason why people with diabetes need better control of their blood pressure is because they have a higher risk of cardiovascular complications. Remember, with diabetes, it is common for the blood vessels to get thicker due to inflammation. Think back to our 1 or 5 lane highways. When the blood vessels are damaged by high blood pressure, they become more rigid. The blood vessels are not able to expand and contract as well. They have decreased compliance. This is more likely to happen in microvascular vessels, especially the kidney. Thus, blood pressure is very important to prevent kidney damage. If you have prehypertension or hypertension, then it's important to check your blood pressure at home daily. Keep a record of your blood pressure to bring to your provider. You should always have your blood pressure checked at every visit. You can also bring your blood pressure monitor to your provider's office to check for accuracy. What are some things you can do to help control your blood pressure? Maintain a healthy weight, daily physical activity, and eat a healthy diet that's low in salt. You could also drink less alcohol, quit smoking, or drink less caffeinated drinks. Take your medications as directed, and manage your stress. Hemoglobin A1C is a reflection of average blood sugar over the past 3 months. Hemoglobin is found inside your red blood cells. It is what helps transport oxygen around your body. Glucose can stick to hemoglobin. This results in hemoglobin becoming glycosylated. When you have high blood glucose levels, more hemoglobin becomes sticky or glycosylated. The reason this is a 3-month estimate is that red blood cells live for 3 months. Why do you need to measure your glucose daily and your A1C every 3 months? Your A1C represents your average blood glucose for 3 months, which gives your provider a better idea of how well you've controlled your blood sugar to that period of time. Some days will be better or worse for you than others. If your provider only saw your blood sugar the day you came in for a visit, it may not be an accurate representation of how you've been doing. For example, let's say your overall grade in the class is a B. You took 3 tests and received 100%, 60%, and 80%. The overall grade of a B represents your A1C. The individual test scores represent finger stick glucose readings and are snapshots in time. If you solely looked at the 100 score or the 60 score, it would not be an accurate depiction of how you did overall. So, what are the numbers associated with A1C? A normal A1C is 5.6% or less. A person with prediabetes has an A1C between 5.7 and 6.4%. People with diabetes have an A1C of 6.5% or higher. In general, an A1C of less than 7% is the common goal for people with diabetes. Talk to your provider about what your A1C goals should be. Your goal can be different depending on your current health. Knowing your A1C can help you and your provider make changes to medications and nutrition and exercise plans. Kidney function can be monitored through urine tests. A few sessions ago, we talked about kidneys working like a filter. If the kidneys are still working properly, then they should prevent albumin from being filtered into the urine in large amounts. If the filter isn't working, then albumin can pass into the urine. This is why albumin is measured. Ketones in urine can indicate poor blood glucose control in people with diabetes. Ketones are produced when the body uses fat for energy because it's unable to use glucose. This happens when there's not enough insulin to enable your body to use glucose. Ketones are toxic, so it's important to check for ketones in the urine. This is especially important during sick days or when blood glucose is over 240 milligrams per deciliter. This can be done at home using test strips. Call your provider right away if you have moderate or high ketones in your urine. Another common test is one that checks your cholesterol. The body uses cholesterol to make important things like hormones, some vitamins, and substances that make up the cell. But too much bad cholesterol in our blood over long periods of time can cause atherosclerosis, which can lead to a heart attack or stroke. There is good cholesterol and bad cholesterol. And the ways to remember is we want to keep the good cholesterol high, HDL, and we want to keep the bad cholesterol low, LDL. And you can help. Lower your bad cholesterol through diet, physical activity, and medications such as statins. You can raise your good cholesterol by eating a healthy diet, staying physically active, and quitting smoking. Now that we've talked about all the tests and numbers, let's talk about things you can do at home to help move your numbers into the target range. We'll specifically talk about physical activity. Throughout these series of lectures, we've recommended physical activity because it improves our health. But how? It can help lower bad cholesterol, blood pressure, and blood sugar levels. It can reduce your risk of cardiovascular disease and reduce the amount of medications or insulin you need to control your blood sugar. But before starting a new physical activity routine, it's important to talk to your provider first. For example, if you also have numbness in your feet, exercises that involve running can be dangerous. So, questions to ask your provider are: what exercises can I do? What type of equipment can I use? Do any of my medications have side effects that can cause hypoglycemia, especially while exercising? Will adding a physical activity routine change how I should take my medications? So, let's go over the general recommendations. Try to get physically active 5 days a week for at least 30 minutes each time. If you can't do 30 minutes all at once, it's okay to do 10-minute sessions 3 times a day. Mixing aerobic exercise with resistance training can be very beneficial. So if you're starting a new workout routine, remember to take it slow. Slowly increase the amount of days, duration, and intensity little by little. Make goals that are reachable. Start off with light activities like walking or hiking. Remember to listen to your body, take breaks, and keep hydrated. For people with diabetes, it's especially important to wear appropriate footwear. Think back to our complications session. Wear white socks, well fitted shoes, and examine your feet before and after exercising. Wearing a medical bracelet can be helpful, especially if you experience hypoglycemia. Exercising with friends or family would ensure that someone can get help if needed. Check your blood sugar before and after exercising. This way, you can determine how physical activity affects your body. Keep sugar candy on you while exercising in case you need it. Remember to be positive. Diabetes can be controlled. Don't give up when you make mistakes. Make sure you set yourself up for success by having all the materials and supplies you need. Keep track of your numbers so you know if your current plan is working for you. Physical activity is a great way to improve or maintain your health. Talk to your provider about any special precautions you need to take before starting a new physical activity routine. Next time, we'll talk about oral medications and insulin. Questions to think about are: what kind of medications are you on for diabetes? Do you have to take any other drugs to lower your cholesterol or blood pressure? Do you have any doubts or concerns about whether your medications are working? See you next time.